This evening's beautiful event focuses on the elements of trauma, compassion, and resilience. And so tonight I ask you please to come with me and hear about the impact of that trauma on children in our society. Hear these words that were spoken to me in my office almost 10 years ago. I think God made a mistake. I think God made a mistake. That's what Samantha, then 9 years old, told me when we first met. From her earliest days, Samantha knew that she was meant to be a boy. He screamed and cried when his parents tried to put him in a dress for school. It wasn't a tantrum. It was a plea for help. This transgender youth was suffering in every way possible. And while many in this world may not label that as trauma, I can assure you that it was. And he wasn't the only one. The trauma that so many children in our society experience include the horrifying images that we see on the nightly news and the tragic experiences so many of them have sadly in their own neighborhoods and in their own homes. Too many children are dealing with exposure to adverse life events, the chronic stress of being terrified to walk home from school or living in a home without enough food or heat. That stress is compounded by a deeper and more widespread trauma. A shortage of qualified child mental health professionals and a poorly funded mental health system has resulted in a crisis that leaves most kids to sort out their distress by themselves. For kids living in poverty, it's even worse. In Cleveland, where I work, an astounding 58% of kids are living in poverty. That puts them at greater risk for developmental, behavioral, and mental health struggles. How can you stay healthy when your home is filled with lead? Your school doesn't live up to basic standards. You fall asleep, or you don't, to gunfire at night, or come face to face with unthinkable violence just playing in a park. Many children wake up with trauma, spend the day with trauma, and take it to bed with them at night. For these kids to heal, for them to live full, happy, productive lives, for them to give the world whatever gifts they have to feel safe. They must have safe places to go with people they can trust with their experiences. They must have hope. But providing that is not their job, it is ours. And this is where compassion is vital. Those of us who do this work strive to help young people and their families feel safe, cared for, cared about, and comfortable. With open minds and open hearts, we let them know that we understand their distress. We affirm their feelings. We listen to their concerns. We make clear that we will not judge. And we do all that we can to offer treatments that work. This is the meaning of compassion, the compassion that we celebrate tonight. But for all those children enveloped in compassion from one provider, there are so many more with outstretched hands unable to reach it. So tonight I ask you please to help us to multiply compassion, to teach it, to train it, to model it, to create programs and systems that expand it to as many people as possible. At Metro Health, we've seen how this can work. We embedded psychologists in pediatric clinics so that families have immediate, same-day access to quality behavioral health care when they visited their pediatrician. We've added more psychologists, social worker, and psychiatric nurse practitioner learners until we've more than doubled our trainees in this compassionate care. And we've added programs and services in more settings, including children in foster care and in Cleveland's public schools. We've added neurodevelopmental programs and services for Spanish-speaking families. One of these programs, which means so much to me, is the Kids Pride Clinic. It was one of the first programs in the nation dedicated to serving the unique medical and mental health needs of gender nonconforming youth. As many as you know, these are among the most vulnerable kids you will ever meet. As many as 40% of children with gender dysphoria will attempt suicide before they turn 20. 40%. These children endure profound physical and mental distress, brutal cultural shame and stigma, and significant legal and societal barriers to care. These kids are scared, confused, and hurting, and so are their families. They often arrive at Kids Pride Clinic in crisis, absolutely lost, desperate for compassion and affirmation. And when they're met with compassion, there's resiliency, there's healing. A light of hope appears and then grows brighter. Their lives turn around in ways their parents and teachers and friends and we, those who help them, never imagine. Tonight, I'm here to say thank you. Thank you very much, Governor Baker, for the work you've done to support the LGBT community. Thank you to the board and staff of the Schwartz Center who inspire us by carrying on the legacy of Ken Schwartz. And to all the other finalists tonight, I'm so honored to be among you. Thank you to my husband, Michael Spatrino, my daughter Lillian, and her fiance, Nick, who are here, and a special long-distance hello to my daughter, Rachel, and her husband, Jacob, who could not attend. Thank you to my amazing colleagues here from the Child Psychology Department at Metro Health. And thank you most of all to the kids we care for, the kids who show us every day that with compassion, trauma can be overcome. That resiliency lives inside each one of us, that with help, we can tap into it and change lives forever. Sam, who I talked about earlier, is no longer Samantha. He's just one of those kids. Sam recently sent me his college entrance essay. Please allow me, if you will, to read just a few words he wrote. What does anyone really know about the lives they have not lived? This part of me that I sometimes feel most ashamed of is also the part of me that I am most proud of. I know that my courage is what got me to where I am today, and it will continue to push me forward as life rolls on. Everyone has a part of themselves that not everybody can understand. Waking up every day and facing that myself has taught me everything I know today about compassion for others. He's amazing. That, ladies and gentlemen, is the power of compassion. If the Schwartz Center does nothing else, it reminds us that the only thing more powerful than compassion is the way it begets more compassion, how it doesn't run out, how it multiplies, how it's passed on and on and on. My promise to you as the recipient of this great honor is that I will do everything in my power to make that happen. And my wish tonight, more than anything else, is that each of you will join me. Thank you.